name is Ariana and I'm from Essence of Birth Doulas. Today I'm going to show you a simple exercise that you can do to help with pubic symphysis dysfunction. Now what pubic symphysis dysfunction is when the two portions of the pubic bone come out of alignment. I'll just show you briefly on my little skeleton here. The pelvis is actually made of two halves, and they're joined in the middle by a piece of hard cartilage-like material. Because it's cartilage and it's not pure bone, there is potential for the joint to loosen. This is really common in pregnancy, especially because the hormone relaxin is working through the body to relax the ligaments and the joints of the body to prepare for childbirth. So quite often you'll find that women will have pain in this area, in the front of the lower groin, because the joint has become loose. So I'm going to get my friend Allison here to help me demonstrate this exercise. You can do it at home, you can do it with a partner, or you can do it with a foam yoga block if you have one of those as well. So to start, I'm going to ask Allison to lie on her back and keep her knees bent and her feet flat on the surface. Now, normally in the second and third trimesters of pregnancy, you want to avoid being on your back because of the possibility of pressure on the inferior vena cava. However, we're only going to be doing this for about 2 minutes, so it should be safe. If, when you're lying like this, if you feel any kind of side effects such as nausea, lightheadedness, headaches, etc., please stop the exercise and gently come back up. So to start the first stage, I'm going to take my fist and horizontally place it between Allison's knees. I'm going to ask Allison to use about 80% of her strength and to squeeze my hand. So what this is doing is it's actually causing the inner thigh muscles called the adductors to activate, and because they're not actually moving the leg, they're staying stable, what they're doing is they're gently pulling on the pubic bones to help rebalance the alignment. So Allison would hold this for about 30 seconds. There shouldn't be any discomfort or any pain. If there is, you can just relax a little bit in how much pressure you're using. After about 30 seconds, I'll get Allison to gently release. There we go. Obviously that wasn't 30 seconds, but for demonstration points, we're doing it a little bit less time. Second stage, again with the horizontal fist, but 2 fists this time, again in between the knees. Again, squeeze about 80% of the strength. Again, there should be no discomfort or pain. And again, hold that for about 30 seconds. After 30 seconds, you can gently release. Okay, you can go ahead and release, Allison. Thank you. Now, the last stage of this exercise, you're going to use the forearm width. If you're having very severe pubic symphysis pain, this third portion of the exercise might be too uncomfortable. If it is, it's okay to skip it and just do the easier segments for now. So I'm going to get Allison to bring her feet apart a little bit more. And again, using my forearm width, I'm going to place my forearm in between her knees. Same thing, about 80% of her strength, she's going to squeeze her knees together. Again, there should be no pain or discomfort when you're doing this. Okay, you can relax. And that's it. So after that, Allison, you can roll over onto your side and gently bring yourself up. There we go. So that's a really simple exercise. You can do at home, you can do it with a partner, or you can do it by yourself if you have some sort of soft barrier that you can use for the counter pressure. You can do that as needed, so if you need to do it daily, a couple times a day, that's fine. And once again, my name is Ariana, and thank you for joining us at Essence of Birth Doulas.